All right, as we head into the fall and winter seasons, doctors want to remind everyone how important it is to get a flu shot and other routine immunizations to keep our families, schools, and communities healthy. And to talk more about that, we have Angela Williams joining us. She is the Senior Vice President from Great Lakes Bay Health Centers. And really, you know, this is an important time of year for our health, and this is an easy way to stop the spread, really.
Yes.
We've talked about everything that's so prevalent during this season. We appreciate you being here. If you kind of start with telling us, you know, why flu shots are so important.
Well, it's important. First of all, thank you for having me again. And it's important that we get it vaccinated, but it's so simple. And the most important message is we need to protect our families, our community, our schools, our kids. We want to protect everyone from preventable illnesses. So flu vaccine, getting it every year should be a simple process.
And we have to remember, too, that we're protecting everyone around us. Even if we're young and healthy, it still makes a difference.
Yes, and we have tools to fight it. I try to stress every time I'm on here, get educated, look at the science. Don't just read everything you see on social media. Read credible information about all of these vaccinations. Our kids, my heart as a nurse goes out to families and children and our babies. When I think about the number of kids who have been affected by measles, but it's not just measles, it's RSV, it's flu. Our babies die from these illnesses that can be prevented.
Now, who needs the flu vaccine?
Well, the flu vaccine is available along with other vaccinations for anyone who's at high risk. So we stress the importance of babies 6 months of age and older as a priority, pregnant moms, women with women and men and women who have high risk medical conditions such as cancer, immune suppressed, asthma, all of those that you think or take for granted that they are not high risk illnesses, especially diabetes. You have a high risk of becoming very ill. And especially we want to stress that flu shot is important for 65 years and older.
For seniors, all right. And
yes.
What are the other recommendations as far as immunizations that protect against other preventable illnesses?
Well, there are other illnesses that you need to take into consideration. Pneumonia and shingles, Tdap, which is tetanus and diphtheria pertussis, HPV, which is vaccine that protects teens and young adults. And then, of course, RSV became popular years ago because of the prevalence of respiratory illnesses in babies, and then to find out through science that the elderly became seriously ill from RSV. So there are vaccines and tests that are available. And most importantly, I know in the news there's been controversy about COVID vaccines. COVID is still prevalent. The recommendations for COVID vaccinations is if you have a high-risk illness or condition, you should be taking the COVID vaccine. And at Great Lakes Bay Health Centers, we have all of these vaccinations available. I was told this morning that our COVID stock is in, and we provide flu and COVID vaccines. You can come as a walk-in to any of our sites. We'll check your insurance, whether you have insurance or not. Those vaccinations are free. In addition to that, the pharmacies now have a stock of COVID. I got my flu shot about 3 weeks ago, and I just went online over the weekend, and I was able to just check out one of the pharmacies, and I was able to get my COVID vaccine on Sunday. I've had no type of side effects whatsoever, and I do try to be diligent in getting my flu shot and my COVID vaccine every year.
Yeah, and it's neat that you said if you have insurance, great, bring that, but if not, that it's covered. There's really, it's a big deal.
It is a big deal because we want our communities to be very safe. So again, I want to reassure the viewers that it is safe, but understand the education, especially for your children. There is a schedule for children to be vaccinated, and that is very important because they are being exposed to all types of illnesses, being around, especially other kids, the runny nose, the respiratory illnesses that are airborne.
Yes.
We want to stay safe.
Now, is that the same reason why it's important for us to stay up to date on all of our immunizations, even as
Yes, it
adults?
is. Yes, yes. Unfortunately, sometimes, especially since COVID, many times the vaccinations, when we were experiencing that crisis, you were going anywhere desperately to get your COVID vaccine. And forget about the other vaccinations. So it's best to check with your physician to find out what is recommended for you and keep a record of all of your vaccinations.
Some good advice.
Yeah.
And when we think about the COVID-19 vaccination requirements, or what sort of things are we looking for to see if it's time to get one? Is it a matter of we haven't had one in a year, or?
COVID can mimic flu per se. COVID can kill you equally as fast as flu. And so our encouragement is get your flu and your COVID vaccine at the same time, or spread them apart. But this is a high prevalence season, fall and winter. It's not too early, it's not too late. And so having these vaccinations available every year the vaccine is different, but is designed by science to keep you protected.
And think about it, it's this time of year, we have colder temperatures, everyone's indoors.
Yes.
So we're spending a lot more time around each other. And you mentioned getting those shots. If you could also explain again how we access the immunizations.
So at Great Lakes, you can walk in to our centers and just express that you would like those shots. And I also recommend seeing your private physician because of the fact that it may be time for your annual physical.
Yep.
You may need lab work done. Things that you might have neglected, that's the opportunity to explain and explore with your physician, discuss what's best, the best interest for managing your own health, as well as asking those questions about your family.
Well, and we take it for granted. It can be a pain to make a phone call, it can be scary, but the smallest of tests can really help us get way ahead of things.
I totally agree. I mean, you may have this little bump on your arm and not realize later on that it could be cancerous.
Yep.
It could be things as simple as that we take for granted, but we need to be more serious and more proactive. And what I always encourage as a nurse, do not walk out of that doctor's office without understanding what that physician was explaining to you. Write it down or challenge the physician to say, please explain this so I can understand it.
Take notes even. I've done that before.
Yes.
All right. Do you have any closing words for us?
Yes, I do. I
advice.
always have to share about things that are happening at Great Lakes. We're happy to announce that we have a new vision bus. Our vision departments have all of these beautiful styles of eyeglasses. Our pharmacy is now available for deliveries, and we have prepackaged where we can mail to our patients, even if they live in the rural areas. We guarantee that they can receive their medications within 24 to 48 hours.
Wow.
If you're a patient at Great Lakes and you're in one of the clinics that has a pharmacy, you can actually see your doctor. Doctor can order the prescriptions, and you should be able to pick them up before you leave that building.
Wonderful. Some great advice.
And I have one more.
Sure.
We want to make sure that our Medicaid population, if you are eligible or on Medicaid, it's very important that you see your doctor as soon as possible. If you feel like you lost your Medicaid, call Great Lakes or go on our website so that someone can help you navigate to confirm whether or not you have a Medicaid status, or we can help you explore other options for health insurance plans. We want to make sure that everyone has the coverage that is suitable for them. As we navigate the challenges of the healthcare system, we want to ensure that you are protected in case you have that emergency and go to the hospital.
Perfect. That's very helpful. We appreciate it. You're not alone in this, is what we're saying. We appreciate you being here, Angela. And we also want to tell everyone, if they want more information on immunizations, just go to the hot link section at WNEM.com.